Today we will be discussing about geriatric health. Coming to the objectives of today's topic, first we'll talk about definitions, the problems associated with aging, prevention of the problems associated with aging, and briefly about National Program for Health Care of Elderly. Coming to the definition. What is geriatrics? Geriatrics is a science or the branch that deals with the problems of aging and the diseases of the elderly. That is, any problems, any diseases that are related to aging and old age is geriatrics. The science which deals with the physiological and psychological changes related to this old age is gerontology. The treatment that is given to the problems associated with this change and these problems is gerontology. More specific, clinical gerontology. Now, as you all know, that aging is a normal physiological process. There is no specific definition for aging because it's a normal phenomenon. It is something which is inevitable, something which cannot be changed, something which cannot be stopped, a phenomenon which is biological. And it starts right from the time a person is born, continues throughout his life, and ends with the death of that individual. And this aging is associated with biological changes as well. Aging is assessed by comparing biological age with chronological age. Now, what is this biological age? Biological age is the age that appears from the looks of an individual. Meaning by that, if we look at an individual and we presume that the individual seems and looks by his appearance, by his features, to be 50, that age is biological age. Chronological age is the age that is the true age. That means from the time a person is born till the time the age is assessed. So how is this aging assessed? It's assessed, like I said, by comparing biological with the chronological age. If the biological age corresponds to the chronological age, that means if the true age of the individual corresponds to the age that is similar to the age that appears from the appearance of that individual, from the looks of that individual, then we say that the person is having a normal aging process. If biological age lags behind chronological age, then aging is said to be delayed. If it has advanced ahead of the chronological age, we say that aging is premature or precocious. It has come well ahead of time. For example, if there is an individual who is 16 years of age, true age is 16 years, but by appearance or by looks, his hair is grey, there is premature graying of hair, or the face looks frail, the person seems tired, not able to do routine activities, what he otherwise would have been able to do at that particular age. So we say that the aging is premature or precocious. Not only are there these physiological changes, but there are other changes as well. Like a person is not able to perform effectively with growing or advanced age. What a person was able to do at the age of 15, he'll not be able to do at the age of 40 or 50 years of age. So he'll person can feel feeble, and there are other vitality is less. Blood pressure changes can be there. There can be many changes. Now, how are old people classified? In India, people aged 60 years and above are considered as old. And people who are up to 75 years of age, they are called elderly, or that's early old age. And more than 75 years of age are old age. But in developed countries, people 65 years and beyond are treated as elderly. So there's a difference. In India, lesser age group is taken as old as compared to that of the developed countries or developed nations. So we all know that nowadays life expectancy is increasing. And with increasing life expectancy, it is understood that the population of the aged will also rise, and that is rising steadily. The world's current population is around 8 billion. And elderly, more than 65 years, like I said, that in developed countries, elderly is taken as 65 years and above. So that is 703 million. It is projected to double to 1.5 billion in 2050. So if it is 0.7 million at this time, so by 2050 it will be 1.5 billion. The population of elderly in India is approximately 104 million, and is expected to grow to 173 million by 2026. Japan is the most elderly country in the world because the life expectancy of Japanese is the highest. It is around 82 years. Now, what are the various health problems of the aged? As I said, that with aging, the capability and the vitality of an individual lessens or it decreases. So the problems associated with increasing age also tends to increase and become more. It's not only one problem, but there are a complex chains of problems that are associated with aging. Problems in the elderly are multiple, many-fold. It's not just, like I said, one problem. At times, there can be just a single problem, and that can result in a complex chain of problems which affect the body functions. For instance, there is a single problem of diabetes. What can diabetes do? With diabetes, there can be neuropathy, but because a person is already old age, already he's having less vitality, his physiological changes within the body have started appearing. So naturally, the neuropathy will be fourfold. It will be more. So it will be because of diabetes. Then again, the problems because of aging will add up to that neuropathy, and the chain of events will become complex, and that can affect the body functions. So he'll not be able to perform his routine work, he'll have aches and pains, he'll be frail and unable to work and perform effectively. The problems of old age are classified based on problems due to aging process, problems associated with long-term illness, and psychological problems. So what are the problems associated with aging? Firstly, the physical problems. Physical problems are the problems which are there, which are there in the appearance itself. You can make it out by looking at an individual. Oh, this individual is old, or he has started going in the process of aging. Initially, the person used to walk say 1 kilometer, now he is able to walk only a few miles. He gets tired very easily. From his skin, the skin has started loosening. There are wrinkles have started appearing. He's becoming thin. A person has become thin and lean. Eyes have become sunken. Hair has become lusterless and gray. So that we can make up by the physical appearance of the individual. Then there can be certain vision problems. The common vision problems associated with aging and old age are cataract and glaucoma, most common, but then there can be other problems as well, other vision problems like myopia, or not myopia, sorry, the short vision problems, other like various refractive errors can be there. The change in the outlook, like I said, the person will appear frail. There'll be changes in the outlook, wrinkles on the skin, physical outlook will be different. Then dental problems, there can be caries, there can be the tooth can start loosening, and there can be aches in the tooth. Then failure of spatial senses means ki temperature sensitivity can decline, hot and cold sensitivity, that sensitivity can become lesser. And osteoporosis is because of the deficiency of minerals, vitamin D, calcium. That is because the person is not able to eat appropriately and not able to eat what he was eating way before. Now, what are the problems associated with long-term illnesses? Diseases of the heart, hypertension, stroke, then cancers can occur, diabetes, mellitus, obesity can be there. Then there can be diseases of the respiratory system like asthma, diseases of the nervous system like Alzheimer's disease, diseases of the genitourinary system like dysuria, incontinence of urine, prostatomegaly, urinary infection. Then there can be fecal incontinence. Then accidents, because their special senses have deranged, so they are more prone for accidents. And this psychological problems, senile dementia, with increasing age, a person tends to forget more easily. A person can feel isolated, that nobody cares for him, have the feeling that people have left him alone. Then social maladjustments, like the person will have bitterness in his mind. Then withdrawal, isolation, he'll withdraw from other people, societal withdrawal. Then he can go into depression, like he will not be having interest in activities. He can become an sadist, the loss of memory. He'll have thoughts of suicide or death. Then change of appetite. He'll like a person will feel like eating less or feel like he doesn't feel like eating. Then sleep pattern will be disrupted. Then persistent fatigue, change in the sleep pattern, like I said. Then a person can go into, because of these emotional disturbances, because of the emotional disturbances, a person will tend to remain away from the people he loves and from his kids and kin. Then prevention of old age problems. How can we take care of these old age problems? Now, this prevention starts from the very beginning, primordial prevention, that is well during the childhood. So during the childhood, if healthy lifestyle is adapted, the old age can become better. Good practices adapted during adolescence and continued in the later life delays the process of aging and improves the quality of life. So it goes without saying that add life to years and not just years to life. You just don't keep on adding years to life. Today I'm 10, tomorrow I'll be 20, tomorrow, day after I'll be 30. So just keeping on adding years to your life is not a good thing. You try to add life to those years by eating and remaining healthy. Then the other prevention is primary prevention. Primary prevention, as you all know, composes of health promotion and specific protection. So we have to promote the health again from the very beginning, from the very childhood, adolescence, later age, and then that will continue in the old age as well. A person should avoid smoking and alcohol abuse. He should be involved in physical activity and exercises. Person should always try to eat a well-balanced diet, and there should be periodic screening for diseases. Those diseases, especially cancers, and those diseases which can be taken care of by early screening and intervention. Then specific prevention is through immunization, which is again given through during childhood or adolescent age and can prevent certain diseases. Then secondary prevention. Secondary prevention is early diagnosis and treatment. Since most old ages diseases are predictable, they can be identified by periodic screening and early treatment. Like cancers, cancer cervix, cancer breast, cancer prostate, like vaginal CA. Then tertiary prevention. Tertiary prevention involves disability limitation. So if a person has become disabled, we can limit his disability by providing instruments and exercises to that individual. Rehabilitation is rehabilitating the individual through various aids. Like if, God forbid, a person is having met with an accident and he has lost his limb, we can give them artificial limbs can be given. Hearing aids can be provided. Then de-addiction, counseling, etc. can be done to these individuals. Now coming to the national program for the health care of the elderly. This program was launched in June 2010 with the objective to provide an easy access to promotional, preventive, curative, and rehabilitative services to the elderly through community-based primary healthcare approach. That means the approach should start from the community itself to identify health problems in the elderly and provide appropriate health interventions. Capacity building of the medical and paramedical professionals as well as the caretakers within the family for providing health care to the elderly. So it means that the people within the family have to be trained in the aspects of taking care of the elderly, to provide referral services to the elderly patients through district hospitals, regional medical institutions. Now, what are the packages of services that are available to these geriatric or old people? Health promotion, preventive services, diagnosis and management of geriatric medical problems, be it outpatient or inpatient, daycare services, rehabilitative services, and home-based care. Districts are linked to the regional geriatric centers for providing tertiary level care. Integration with existing primary healthcare delivery system and vertical at district and above, as more specialized healthcare is needed for the elderly. Now, what are the sub-centers? Like I said, the services are provided right from the community, from the base. So the base or at the community level, the center, the primary health care is provided at the sub-center. So what are the services provided at the sub-center? Health education is given to the elderly. That is education relating to the healthy aging, how they can take care of themselves, how they can modify their behavior, how they can change their lifestyles, which will enable them to age in a healthy way. Then domiciliary visits to homebound and bedridden elderly patients. If there are patients who are having some problems or are not well, the workers present at the sub-center have to pay visits to these people who are bedridden. The arrangement of suitable calipers and supportive devices, linkages with other support groups and daycare centers, and provision of ambulance for these geriatric patients, for the geriatric people. Then services at the primary health center. So there is a weekly geriatric clinic by a trained medical officer. Conducting a routine health assessment of the geriatric population, like there is examination of the individual, ophthalmic examination is done, general physical examination is done, systemic examination is done, then blood pressure is checked, blood sugar is checked, and there is a record which is established or set up at that PHC for maintaining the parameters of these individuals for follow-up and references. Then provision of medicines and proper advice on chronic ailments, that will be done by the medical officer. Public awareness on promotional, preventive and rehabilitative aspects of geriatrics during health and village sanitation days and camps, and again referral services if and when needed. Then services at the district hospital. Geriatric clinic for regular dedicated OPD services to the elderly. There has to be a lab for testing and adequate medicine. So the geriatric ward in the district hospital is a 10-bedded ward with existing specialities. The specialties are there, but there is a 10-bedded dedicated ward which is dedicated entirely to this geriatric population for all the specialities. Again, services are referral services. They can be from here, they can be referred to tertiary care institutions, and they are referring centers from PHCs or even CHCs or community health centers. They are responsible for conducting camps in PHCs, CHCs and other sites for these geriatric population, wherein they will do the examination and check the various blood and other parameters of the geriatric population. Services at the regional geriatric center. The regional geriatric center has a specialized OPT for the geriatric population. There is a 30-bedded geriatric ward. Again, lab has to be there with a special sample collection center in the OPD block. Tertiary health care to the cases referred from medical colleges, district hospitals and below. So this regional geriatric center is a referral center for the medical colleges, for the district hospitals, for the PHCs, for the CHCs and the sub-centers. Thank you.